productivity is based on, can you actually treat patients at the moment they need to be treated? And can you do it in an efficient way so your patients aren't waiting in the waiting room, or your staff is not getting stressed, or quite frankly, you can make sure that you have the tools you need at the time you need it to take care of these patients.
Rising above the buzz of ultrasonic cleaners and the clanking of stainless steel are the ideas and voices that are changing an industry. You're listening to the Beyond Clean podcast, the central nexus for the people, processes, and products that are improving our sterile processing world. Each week, we speak with frontline technicians, CEOs, engineers, and entrepreneurs with a common goal to help you bite dirty. Every instrument, every time. Whether you are tuning in for education or inspiration, we're glad you did. Now turn on those washers and turn up the volume. It's time to go beyond clean.
On this vendor spotlight, we are going to speak with Christian Escobar, Vice President of Marketing at Ambu USA. He's going to be telling us all about single-use endoscopes. You've probably heard about them, you've probably seen them, and you might already be using them. But Ambu launched the first single-use bronchoscope and have expanded into markets like pulmonary, ENT, urology, and GI. And with the challenges in reprocessing in those non-acute settings away from the experts in the acute setting, it certainly has created some challenges. Christian's going to be joining us today to tell us about why this is a scalable solution. So stay with us. We're going to be right back with Christian Escobar.
From 17 Studios, you're listening to Beyond Clean, the global voice of sterile processing.
Speaking now with Christian Escobar, VP of Marketing at Ambu USA. And Christian, I don't think we've had a conversation around single-use endoscopy yet on the Beyond Clean podcast, and I'm really excited it's going to be with you. So welcome to the show.
I'm really excited to be here. And I'm very excited to be here as the first on the subject matter, especially because the audience for Beyond Clean and so many of these great podcasts are very interested in the subject matter, and they're looking for more information on how single use can fit into what they're doing day in and day out. So we're really happy to be here.
Yeah, we're going to talk a lot about that. Is also how healthcare is changing in the environment and the way, where, and how we deliver that care to the patients, especially related to endoscopy. So, but first, why don't you just tell everybody a little bit about yourself? And you told me a great story before we got started with recording that you actually moved in the early days of the pandemic for this job. So why don't you just tell us kind of your background and how you got to Ambu?
Sure. No, that's great. Yeah, I did move during COVID. So fun times. But no, I've been in med device for about 25 some odd years. A vast majority of that has been in endoscopy, a lot of endoscopy solutions, different types of innovative endoscopy solutions. And about 3.5 years ago, very excited to join Ambu because I thought they were doing something very, very different in the endoscopy space that I thought not only was good technology for patients and healthcare providers, but that I personally was very interested and thought could better improve healthcare. So I was excited to join the company. And yes, I moved from New England down to Columbia, Maryland, where the U.S. headquarters is.
Well, Christian, I know Ambu because when I worked as a nurse, we heard all about the Ambu bag for resuscitation. And so, it's excellent. If you think about doing CPR the old ways, this is a much more effective tool for being able to deliver, air and oxygen, when you're trying to resuscitate a patient. Most of the people listening to this have no idea about that, but I was very, very familiar with the company. Can you tell us a little bit more? And even then, how did you wind up in endoscopy?
Sure. Great question. So Ambu is an 80-plus-year-old company. It's been innovating the entire time. And as you mentioned, the resuscitator business is something that's basically in Ambu's DNA. They call it the Ambu bag for good reason. And so the company has spent decades really building an anesthesia, patient monitoring legacy business. It's been, well known throughout that part of healthcare. But about 10 years ago, the company was looking at anesthesia and they were looking at ways to innovate. And one of the things they noticed was anesthesiologists were using bronchoscopes or intubation scopes for specific types of procedures, DLT placements or difficult airway. And they had an idea. They thought that they could bring a single-use version of that product, that reusable endoscope, replace it with a single-use one in the OR where it's really hard to get reusable equipment, and really innovating and provide a tool for the anesthesiologist to really be able to deliver that patient care when needed instead of waiting for a scope or something like that. And that kicked off a whole spur of investment and innovation in the single-use endoscopy world for Ambu. It led with really becoming the market leaders, not just in market share, but also in innovation in the single-use bronchoscopy category. So Ambu is very, very well known at this point within bronchoscopy and pulmonary and critical care and anesthesia for the single-use bronchoscopy market. We didn't just kick it off. We have continuously done innovations there that have led the way in the marketplace. But that also meant there was a great opportunity as the market and the healthcare providers started to really accept the benefits of single use, that we could look at other areas like urology and ENT and GI and start to innovate in those spaces. And of course, that's been a big part of the story over the last 3 or 4 years for Ambu.
Yeah. Well, I mean, things changed at the same time, right? So as you were innovating into this space, I mean, everybody's somewhat sick of hearing about COVID, but I would say that did change everything. It changed, things for sterile processing. It changed the way healthcare looked at infection prevention. There was already a lot of conversation around superbugs before the pandemic. And I know COVID, took a little bit of that attention for quite a while, but I think people, are still looking at, okay, we've had these outbreaks, we're talking about complex medical devices. There are challenges around training and all of that for reprocessing reusable medical devices, and especially the complex ones that do exist in endoscopy, the debate between sterilization and high-level disinfection. And so, what else did you see that really brought more and more attention to this single-use market?
Sure. That's a great question. And I do think it is a good to look back at maybe the last 5 or 6 years to see that cadence that you just mentioned. I should begin with that endoscopy, and specifically flexible endoscopy, is incredibly valuable in healthcare. It's so important that patients get this care. They get it when they need it. These tools are just so invaluable to the providers for the work they do. And as you mentioned, as time has gone on and they've become more complex and they've become more valuable and they've needed to do more endoscopy cases in different places, you had things like general infections, and then that was followed by superbug, and it created this critical mass around how we actually create the margin of safety in reusable devices. How do we clean them properly? How do we make sure they're patient ready? And in the midst of all of that, there was COVID. And COVID, of course, it changed everything for everybody. That's kind of the cliche at this point, I think. But really especially for a company, obviously in single-use bronchoscopy, where you're having to bronchoscope patients that are on ventilators who have COVID, it really reinforced, I think, not just the infection prevention side, because I think that's something the single-use device market, scopes, other products, has always kind of been in the midst of when to have reusables, when is single-use the right product to use, what's its value, et cetera. But what I think COVID really refined is that single-use endoscopes weren't simply an infection prevention device. Of course, that's its intrinsic value, but it actually had something else that was, I don't want to say arguably more valuable, but certainly as valuable, or even in certain circumstances, really important to keep in mind. And that is, single-use endoscopes provide in a really effective way to have an endoscope that's ready when you need it in virtually any point of care, regardless of the back-end infrastructure, regardless of how much inventory of scopes you have, who's cleaning them, where they're cleaning them. Single-use scopes are are right there. You plug them in. If you have to bronch somebody on a ventilator at 2 a.m., you plug it in, you bronch the patient. You don't wait an hour for them to bring equipment. And I think in general, prior to COVID, this was an incremental realization in the market. They were seeing this in different areas, primarily in bronchoscopy, but also in some other areas like ureteroscopy and some other early areas of single-use endoscopy. But really, like I said, COVID, where, post-COVID, not only was this kind of endoscopy anywhere or kind of ready when needed endoscopy become very, very valuable. It was what came after COVID that has probably been the launching point to some of the big adoption waves we've seen in single-use endoscopy. More, Ambu's leading this, but there are other companies in this space.
And, let me jump in on that too, because I feel like one of the challenges post-COVID was we had all these patients that needed procedures. We weren't doing quote unquote elective procedures. And, a lot of the procedures in endoscopy were considered elective versus life-saving. And the problem was not only from a staffing model standpoint, but maybe even an inventory standpoint, how did we catch up on that backlog? And there was really a cap on the ability to do so. And it could be inventory, it could be personnel, et cetera. But, I'm just wondering, did that backlog of procedures, I think that also sort of was pushing the momentum that was already in place to do more and more of these procedures in a non-acute outpatient setting so that you could increase the capacity. But again, think about the capital investment up front to scale that up, right? Did that all kind of also converge, as you saw greater adoption?
It did. And I think you bring up a great point. During COVID is when, at least Ambu, we launched our products into urology and ENT. Essentially during COVID. And so as you mentioned, as COVID as a pandemic, as an emergent situation began to wane, in the aftermath, you had these challenges. One, you had tremendous backlogs of patients in all these outpatient procedures, urology, ENT. You had surgeries coming back, which meant that people were going to be going back into the SICU, were going to be in the PACU. You'd be doing more basic level procedures. You had this big bolus, whether you had capital reusable endoscope challenges or not, which many places did. What they really discovered post-COVID was they also had labor issues. They had staffing challenges. They had trouble hiring people, bringing people back to work, people working in the environment, people that were necessary to bring equipment back and forth to central sterile, people working in the outpatient centers. It was becoming a real challenge for these hospital systems. And that combines with the fact that you now have a new environment for procedure demand. All of a sudden you need to do more cases in less time, so to speak, based on the backlog. And you're overly reliant on having capital, having reprocessing, making sure that this is meeting your need at the exact time you're trying to increase patient throughput. And so it's very easy to see where the momentum of single-use endoscopes comes into play, because you have these outpatient clinics, which the hospitals began prior to even COVID, began moving a lot of these procedures, these very quick diagnostic endoscopy procedures, out of the hospital and into the professional buildings, into the satellite clinics. There's a big movement to push this healthcare closer to the patient, which we think is great. It's really great healthcare concept. But at the same time, you're getting this higher patient volume. You're getting this need for higher patient throughput. And you have these post-COVID challenges with capital equipment, reprocessing, staff, being under tremendous stress through COVID and then after COVID. And it was just a really kind of a critical moment in which I think single-use endoscopies, value beyond just infection prevention began to be realized.
Yeah. And I'll say too, as we see more and more of the care delivered, out into the community might even be the best way to say it, right? Because that's kind of the whole point of accountable care. And, it's really to get that care closer to patients' homes. And you think about the challenges of rural healthcare. But an even bigger challenge, I think, is you have all the experts, in many cases in the acute setting, for reprocessing. And so all of a sudden you have this new, training and education demand as more and more people get involved in the reprocessing of, these endoscopes and gastroscopes, et cetera, like all of them. And so, and I just look at that and I say, how is that sustainable, right? And I think it's a big challenge that everybody is looking at in the industry, especially with an increased focus on reprocessing at a time where we're also dealing with some staffing issues in that area.
Sure. That to me is a really great question and comment and insight with regards to this moment in healthcare. Because as you mentioned, if you think of the experts, the central sterile teams, the reprocessing teams, the surgical services teams, they are, the experts. They're in the hospital. They are trained. They are held to compliance, and they have all these, strengths and capabilities. And then at the same time, the healthcare network or whoever is moving some of the procedures out into this environment where now you're asking nurses or you're asking medical assistants, physician assistants who quite frankly don't have any training or certainly don't have the support network of training or that exists for central sterile teams in a professional building in a small town or quite frankly, even down the road from the hospital, which might as well be a small town, in terms of the distance between the knowledge. And so that's where single use, you definitely see single use is getting a lot of adoption and is being seen as a real opportunity to help these clinics move very efficiently. Because the only alternative that you're seeing when it comes to a healthcare system is sometimes they're trying to take the compliance levels that they have for in the hospital central sterile teams, and they turn around and they go down 2 streets or off campus and they say, yes, your small clinic with 8 exam rooms also has to have this level of compliance. And of course they can't meet it. So now you have something like they're carrying scopes across a parking lot or down the street. And that just, that is not going to help anybody in healthcare in the long run. Right. So I think,
logistics wise,
right? No matter how well you train people,
100%.
And productivity is not based on that, right? Productivity is based on, can you actually treat patients at the moment they need to be treated? And can you do it in an efficient way so your patients aren't waiting in the waiting room or your staff is not getting stressed? Or quite frankly, you can make sure that you have the tools you need at the time you need it to take care of these patients.
Yeah. It's interesting just as you're talking through that, like the logistics piece, like think about somebody who is a human has to spend the time to move that equipment from point A to point B. And sometimes it's got to be transported. And I think that's another big challenge for sterile processing departments is as we do have the industry get elevated, and they get recognized for their expertise, we also see organizations trying to bring equipment from those non-acute, or even subacute settings into central sterile. But the minute you leave the facility, there are lots of challenges, also just in terms of the Department of Transportation and, transporting contaminated instrumentation and devices, back. There's like lots going on in that conversation, but also, how do you route the equipment back to the appropriate department? And they're also on their own budgets. And so how do you, like, if something's damaged in transport, who owns the budget for repairing the device? Like, it just does become a little bit muddy when you're going away from the facility.
To be honest, Justin, your description of it is so, like, you just see the complexity of it. And what I would argue to say is the unworkability of it in terms of long-term development in healthcare, right? Like, of course, hospitals might need to do this today, right? Because there's not another solution, but it's not, nobody would argue that that's the productive and appropriate way to move equipment around or to deliver patient care, regardless of, like you said, you can always ask someone to do this, but you don't want your experts that you're making investments in training and making sure that they are keeping operating rooms on time and, surgical equipment's being cleaned and reprocessed properly. At the same time, somebody showing up out of the blue saying, I've got all these scopes from an outpatient clinic down the road. They had 2 scopes break. Can you clean these now? Can you stop what you're doing now? Like, immediately as you take that and you overlay that kind of mentality over the description you just had, that's a stressful environment. And when you have a stressful environment, that's not great, not just for healthcare workers, but the system in general. because that's where your margin of safety begins to get wobbly. People really start to try and figure out like this, people get stressed and they get yelled at, and doctors are looking for equipment, and people are, trying to do the best they can. And to me, I'm a big believer, and this is not unique to healthcare, but in general, it's when you have people who are dedicated to their jobs, you should try and create environments in which they can do their best work. And we have a central, if you think of the whole groups of teams that are doing reprocessing and the myriad of equipment, not just flexible endoscopes, but all the stuff they have to clean and reprocess and build and elevate that and build that expertise and put value around that as incredibly important members of our healthcare continuum. You have to create the environment for them. And I think that's where single-use endoscopes plays a big role, is that you look at where the convergence between those teams and the healthcare providing teams, being the end users, people who are actually doing the cases. How do we create an environment where, both can focus on what they need to do to deliver what they need to for great healthcare?
Yeah, even think about just timeliness too. Some of this equipment's used in the ICU or the emergency room, and there's urgent, procedures, and you can't anticipate the volume that may be coming in. Does that fit into your value prop for single use as well?
It does. I mean, I think that's one thing that, and we've seen it already with both, whether it's the ICU or outpatient clinics or in the OR, a number of single use endoscopes are used at, we'll call it 24/7 points of care. And in a reusable environment, this puts a strain on inventories, time. It's very difficult to provide this care when you need it. So hospitals can choose to do a few different things. They can make significant investments in capital equipment that they have no idea of the volumes up or down for these emergent cases or these 24/7 types of cases. And on top of that, plan for these scopes to break or go down or be in repair and so forth. Or they can choose to look at single use as, again, a ready when needed solution that, quite frankly, doesn't require investment the same way as reusable scopes to do a fluctuating volume of procedures. For our single use endoscopes, we have a great ecosystem, an all-in-one display, a lot of different scopes plug into it. It's fantastic. That's really the investment you can make. Other than that, if you need to do 40, bronchs tomorrow, you can do 40 bronchs tomorrow, and you're not depending on the schedule of how many scopes you have, which ones are down, which ones are out for repair. Do we have a loaner? Is reprocessing backed up? Right? You can go down this huge list, or you could just open the package and do the case.
Yeah. And the ROI,
and if there are 40 or 10,
calculate. Yeah,
exactly.
Because cost per procedure is really how hospitals think about, what the costs are operationally versus the revenue. It's per procedure. And so I can see that your model aligns with a very simple way of doing the accounting.
100%. And I think forgive me, I'll say one of the cool things about single use endoscopy and its technology opportunity is that hospitals and clinics, they can look at how they do and they provide, or how they do endoscopy, or how they provide endoscopy in an economic sense, right? From a cost of care perspective, in a completely different way than the architecture that's been in place for 40 or 50 years. So for a good example, there was a recent study that showed that using our cystoscope, a very busy academic center clinic could do, go from 12 to 21 patients a day. And of course, when we talked backlog earlier, you can see how valuable that is. Now, that's one part of the story. I mean, it's efficient and it's great. It's good patient care. You can do it in a productive way. But from a cost perspective, now they can actually, if you think of a clinic that is looking to do higher patient throughput, of course they have reimbursement and they get paid for these procedures. But if you're able to do more procedures, do them effectively, do them in less time, meaning more productively, and add additional procedures, whether they be endoscopy or not, but within the day, then you know that the general cost of care is just going to be better for the model, for sure, than making the investments in reusables and additional people and reprocessing units and constantly making additional kind of, we'll call them capital investments in supporting that up and down growth. From a cost perspective, it's very transparent. I spend X dollars on a reusable scope and all of the architecture around it, which is a lot of money to keep operating every day. Or I can spend X dollars on a single-use endoscope and get all of this crazy productivity value and infection prevention value, right? And staff satisfaction value and patient experience value. It's a completely different way of looking at the model rather than just do I spend X or Y on each of these services. They actually do deliver two different experiences.
Yeah, you need less experienced staff to scale up when you're trying to, increase volumes. And, I mean, even kind of just thinking about this a little bit, when you think about equipment that's coming off the shelf, right? And making sure you have enough, I'm wondering, do you sort of help customers with par levels? Do you look at their case volume and how they plan to integrate? How do you help them strategically too, so that they're being really proactive? Because this is very innovative and disruptive, right? So they are not thinking about managing this inventory the way that they did before, because it's a totally different type of solution.
Sure. That's actually a great question, because I think for a lot of hospitals, and even hospitals that have been in single-use bronchoscopy for a few years, especially maybe even during COVID, and now are expanding to all these other single-use endoscope options, urology, ENT, GI, et cetera. It's new ground for hospitals. So how they, you mentioned par levels, and this is a very, obviously from Ambu's perspective, we have a lot of people on the ground. We have obviously a very great, I think a great sales force, but we also have a nationwide network of clinical trainers who do a lot of work with staff and other stakeholders, not just the HCPs, to make sure that the actual implementation of single-use endoscopy is fully realized. So what I mean by that is not just par levels, right? Are you scheduling effectively? Can you do more? Do you have the right level of displays to be able to be mobile around the hospital? Do you have the right setup in all 13 of your outpatient clinics so that they are all operating the same and have the same compliance levels with single-use endoscopes? Because we know how critical that is in these kind of, 13, 14, networks of clinics that hospitals may operate. And so we spend a lot of time, supporting, our customers in various ways. You can adopt single-use endoscopy in a couple different ways. You can actually just adopt it and use it again as kind of a one-for-one replacement of reusables. Nobody's going to fault you for doing this, but that's what we try and help the hospital networks do, is realize all the things I mentioned earlier, which is there's, when you actually do have a good sense of your par levels, going through that process, you start to realize, wow, I have now the freedom to do endoscopy in a lot of different points of care in a lot more efficient ways. And that's something that's going to change a lot of aspects here in the hospital, whether it's scheduling or availability or who can, will the ENT resident be down at the ER for a consult on time? Or will it be 3 hours later because they're looking for equipment, right? And if they're going to show up down there at 3 a.m., let's make sure we have everybody trained. They know where the equipment is. They know where to we have a hospital that actually puts single-use endoscopes, our ENT endoscopes, in the Pyxis system. So the residents who at 2 a.m., again, they have to go do a consult in the ER, they can actually go to the Pyxis system, pull it out of the machine. Everything's tracked. They grab the equipment.
Oh, and they assign it to the patient too. For billing.
Yeah,
that's
exactly.
Genius.
It's amazing, right? And you could do this stuff in a very, very productive way. And again, hospitals aren't necessarily always going to think about those things, because they think of endoscopes obviously as tools, and they have this 50-year architecture of how it's kind of performed and done. And then all of a sudden you have a single-use version of this that opens up all these other opportunities. And our teams on the ground, whether it's the sales team or our clinical training group, their goal is to make sure that all the stakeholders in the hospital recognize all the values that single use can bring.
Yeah. Do you have any success stories, or maybe, some examples, even if you can't mention the customers directly, about, how they've utilized this and maybe how you've assisted them with KPIs and process validation and streamlining all that to make this process more manageable?
Sure. I mean, there's at this point, there's probably a lot, there's probably a lot of examples. What's been very good over the last couple of years is there's starting to be a lot of peer reviewed research, that's come out. So even beyond just kind of some of the anecdotal examples I can mention today, there's a lot of really great research that's showing out all the value, whether it be efficiency or cost savings, right? One example is a hospital started to recognize, they had switched over to single-use cystoscopy and had started to recognize that they were seeing an intrinsic differential in their encounters following cases. And that felt unusual. So they started a process, and it turned out to be research, to look at the differential when they were doing procedures, and they had a huge bulk of procedures they were doing with reusables, and then look at kind of the experience that they had with single use. And what they noted right away was that their encounters, and these encounters could be anything, could be post-procedure infection, could be just post-case follow-ups, could be a number of things. And that's in the research study.
But related to HCAP scores, patients who come back in, if it
generally
is with
speaking,
an infection,
could be.
It may not be a one-to-one, but it's one of the possibilities that really could hit the healthcare organization financially, the bottom line.
Correct. And I think, and of course, that's an area that still needs to be explored. A few years ago, there was some research that came out on single-use bronchoscopy versus reusable bronchoscopes. And the research that came out that showed that the readmission rate was lower for those patients who had received a single-use bronchoscopy procedure versus those who had received a reusable bronchoscope procedure. Now, when a lot of people see that research, they of course think, oh, maybe is that infections? And it's not necessarily research that down to that level. But more importantly, what I think the opportunity is to look at that kind of data, and as you mentioned about hospital metrics and really things that are really, really key to how hospitals operate in a KPI setting. Probably a lot of reasons that goes into why that rate was reduced. Some of it obviously is the implication is, of course, infections, but some of it may be that you have a bronchoscope ready when needed, that you're able to do bronchoscopy when you need to do it, that it's easier to use, that maybe it's fully functioning, right? There's a lot of different things there. So that's, an area of our single-use bronchoscopy line that's really valuable. I think lastly, I think from, I would say one of the better anecdotes that I heard, recently was that, and it pertains to your audience, and it's a very interesting one. So we have a flexible ENT system, and it's utilized by a speech language pathology team at a hospital network where they do flexible endoscopy evaluation of swallowing, swallow studies basically for dysphagia. And they do them in a number of different scenarios for outpatient, inpatient. And this clinician, she met me at a conference, and she said, we've been using your scope for about 6 months. And she said it changed her world. And the reason and she detailed it really succinctly. She said, before I would go and I would do a 30-minute swallow study, called on to a post-extubated patient. I need to do the swallow study. I would do this. I would do the procedure. It was 30 minutes or 15 minutes. But then I would have 3 more procedures, swallowing studies I would need to do, but I couldn't just go do them. I would have to go down to Central Sterile with my ENT scope, my one ENT scope. And I had 3, 4, 5 other cases to do during the day. I would bring my ENT scope down to Central Sterile. They would take it. They would clean it. I would literally have to wait 45 minutes or an hour. This is her telling me the story. And they would give it back to me in a way that I, cleaned and ready to go. And I would go and then do the next fees case or my next swallow study. And then I would start that whole cycle over again. And I would be doing 3 or 4. And by the way, she would tell me she would have to wait by Central Sterile, because if she went away and came back, that would be even less productive, right? So what happened when she moved to single-use ENT scopes was that now, if she has, you mentioned earlier, if she has 5 cases that day, or she has 2 add-ons, they call her down to the ICU to do a case, she could just go do it. And she says it all the time. We do it when we need it. We're called, we're timely. And I can then go back and I can actually be very productive with report writing and all these things. It completely changed the way that they deliver care in that hospital. And for the record, that is a procedure that actually can define course of action in care. So, they're vital and intrinsic to deciding whether or not a patient gets a feeding tube or a peg or something like this. And so having timely procedures is really crucial. And so we were really, obviously that makes you feel good as a vendor. You hear that that feels a very demonstrable improvement of healthcare delivery, of which I think we're pretty proud of.
Yeah. Well, you can just, that example really highlights efficiencies that can be gained. And again, in those clinic settings, just think about, if you don't have enough inventory, you don't have a scope ready, are you pulling from another department's inventory, or, how long does it take to get it reprocessed and then delivered to that department? Like, there's a lot of factors, because most sterile processing departments were working within kind of this workflow of surgical services, right? And it's a very linear flow. But the minute you leave sort of the department and the dedicated elevators, people are running around, leaving the department. There's, again, back to the logistics, even within a facility that has like speech pathology, services that are being provided remotely. It's not just these remote clinics that we still face those logistics concerns. That's for sure. I know there's been a lot of curiosity around single use, and I do want to let our audience know that they can get more information by going to ambuusa.com. That's AMBUUSA.com. You can follow them on LinkedIn. And, Christian, how else can the audience learn more, get more information around how they can do something, potentially transformative in the way that they do endoscopy procedures in their facilities?
Sure. That's the best place. and Ambu US. And I think if you go to that site, you'll find there's a lot of landing pages specifically for all the stakeholders. So the clinical users, but also we have a landing page for central sterile staff where you can learn a bit more about the research, the data, and some of the different opportunities in which single use can help. That's at ambuusa.com/sterile-processing. And we have a page for infection preventionists, ambuusa.com/infection-control. So we also operate a learning center online for all different types of stakeholders. It's singleuseendoscopy.com. And there's a lot of great material on there for all different types of stakeholders and how single-use endoscopes can have an impact, how it can be applied and implemented for different improvement strategies, and also a really great place to learn about different technology sets in general about endoscopy. We try to be very robust on that front in this learning center.
Well, Christian, this was a great interview. And I think, sometimes to your point, this conversation really just gets boiled down to infection prevention, but not necessarily like the business sense of healthcare, which is really under a lot of constraints. The financial pressures on healthcare organizations have really never been greater. And so I want to thank you for sharing your insights during this podcast today, not only on single-use endoscopy solutions, but also, just kind of framing up how healthcare is changing the way it delivers care and how it's adapting to this environment. So is there anything you want to add before we wrap up?
Again, I appreciate the time and the opportunity. I really enjoy these podcasts from the team here, but also I think we mentioned it when we were talking earlier. I really appreciate that your audience is such an integral and vital part of how we deliver healthcare in America today. And it's just great to see them get the support and to get the opportunity to have voices, speak to them, and to have their own voices heard throughout the mediascape. So fantastic.
That was Christian Escobar, Vice President of Marketing at Ambu USA, talking about single-use endoscopy, certainly disrupting the marketplace and making the challenges of reprocessing support in an increasing number of points of care, especially in those non-acute settings, much more realistic, and even the finances. What I loved about the conversation with Christian today is it was more than just talking about not having to reprocess endoscopes, but a lot more about the business of healthcare and how it is changing. So I learned a lot today. I do want to remind everyone that you can learn more by going to singleuseendoscopy.com or go to ambuusa.com. Find them on LinkedIn. Go ahead and connect with Christian as well. Great conversation today. Thank you for listening to this Vendor Spotlight on Beyond Clean.
Thank you for listening to this week's episode of Beyond Clean. As a reminder, you can help support us by subscribing to Beyond Clean on your favorite podcast app or by downloading the smartphone app on iPhone or Android. Simply search for Beyond Clean in the App Store or Google Play. The best thing about downloading the smartphone app is that you can access bonus content for certain episodes and view episodes in certain categories, like articles on the go and vendor spotlights. Are you following us on LinkedIn or Facebook yet? If you are and you love an episode or post, then let your social network know about it. Like, comment, or share our posts along with your thoughts and keep the conversation going. If you have any topics or guests that you would like to recommend for a future episode, just send us an email to info@beyondclean.net. We look forward to hearing from you.